This video is a step-by-step guide for you and your child to find out what happens during a school entry health assessment, usually referred to as a SEHA. The SEHA is a free health check. We offer it to all children in WA the year they begin school, usually kindy. It's a follow-on assessment from the Purple Book Child Health Checks. The check is done by trained school health nurses. Most SEHAs are done during school time. The nurse will tell your child what's going to happen and will make sure it's a fun and safe experience.
Did you hear that?
If your child seems distressed, uncomfortable or reluctant to do the checks, the nurse will stop and take them back to class. The nurse will check your child's general health and development, as well as their vision, to check how well they can see, hearing, to check how well they can hear, growth, to track how they are growing and developing, teeth and mouth, to check for signs of tooth decay or any other concerns in their mouth. The nurse will use a variety of tests to check your child's vision. The LEA chart uses 4 different symbols arranged in a mix of symbols on each line. Your child will be given special glasses to wear that test each eye separately. They will sit or stand 3 metres from the chart and the nurse will ask what symbols they can see.
What shape is this?
If your child can't do the test on the day, we'll do a follow-up assessment within 3 months. Reflection test. The nurse will use a small light to look into your child's eye to check the reflection is equal in both eyes. Cover test. The nurse will hold a small card close to your child's face while they focus on an object. Normal hearing is vital for the development of language and communication. The school health nurse will use a variety of tests to check your child's ears and hearing. The nurse will look into both of your child's ears with a device called an otoscope. This lets the nurse see your child's eardrum and the health of their inner ear. Next, the nurse will do an audiology test. Your child will wear headphones and the nurse will play a sound. Your child will be asked to raise a block or their hand when they hear a sound.
Good girl.
Each ear is tested separately. We may also offer extra hearing assessments for children at increased risk of hearing problems. The changes your child goes through as they grow is called development. It's how they learn and apply new skills to develop more complex tasks such as walking, talking and playing. The nurse will check any developmental or health concerns that you mention in the form or that the nurse or teacher has noticed. The 5 key areas of development are gross motor skills, like jumping, hopping or running, fine motor skills like writing or drawing, speech and language skills, talking and communicating, cognitive skills, thinking, learning and remembering, social and emotional skills, playing and communicating with others. Assessing growth is an important part of what child and school nurses do. We've been measuring your child at Purple Book Child Health Checks since they were born. During the SEHA, the nurse will weigh your child and use a special ruler called a stadiometer to measure how tall they are. We use both these measurements to calculate your child's body mass index or BMI. We will not share results with your child. If there are any concerns, the school health nurse will contact you to discuss. This will give you an opportunity to ask any questions too. Finally, the nurse will look inside your child's mouth. They'll ask your child to smile.
You ready?
Open their mouth and use their fingers to lift up their top lip. The nurse will look for any signs of visible tooth decay or any other concerns in the mouth. Once the SEHA is completed, the nurse will give your child a sticker and take them back to their classroom. Your child's results will be sent home in a sealed envelope. If your child needs a recheck, the nurse will let you know and try to reschedule this within 3 months. Together with your child's teacher, the nurse can provide more information and help you organise a follow-up assessment or referral. Your nurse is there for your child throughout their primary and secondary schooling. Remember, you can talk to the school health nurse at any time if you have concerns about your child's health and development. Just contact them through the school office.